Hi, Anonymous. There are several paired arteries that branch off of the aorta. We'll go from superior to inferior. First, we have the inferior phrenic arteries. Then we have the middle adrenal arteries. Then we have the renal arteries. Then we have the gonadal arteries, which supply the ovaries or the testes. Then we have lumbar arteries. Finally, the aorta bifurcates into the common iliac arteries. Everything supplied by these paired arteries is drained by the caval system. The unpaired arteries include the celiac trunk, the superior mesenteric artery, and the inferior mesenteric artery. These supply the foregut, midgut, and hindgut, respectively. The celiac trunk has three branches. The splenic artery, which supplies the spleen and branches into the short gastric arteries and the left gastromental artery. The left gastric artery, which supplies the lesser curvature of the stomach. And finally, the common hepatic artery, which branches into the hepatic artery proper, the right gastric artery, and the gastroduodenal artery, which branches into the superior pancreaticoduodenal artery, as well as the right gastromental artery. The superior mesenteric artery gives off the inferior pancreaticoduodenal artery, the jejunal and ileal branches, the ileocholic, right cholic, and middle cholic arteries. The inferior mesenteric artery gives off a left cholic artery, sigmoid arteries, as well as a superior rectal artery. Blood supplied by the unpaired arteries drains into the hepatic portal vein. The inferior mesenteric vein drains into the splenic vein, which then joins with the superior mesenteric vein to become the hepatic portal vein. Blood is processed by the liver and then drained into hepatic veins, which go into the inferior vena cava. If the hepatic portal vein is blocked, blood can still make its way back to the inferior vena cava via anastomoses between the portal and caval venous systems. These are between the esophageal veins and the azygos vein, the paraumbilical vein and the superficial abdominal veins, between the superior and middle and inferior rectal veins, and between the colic veins and the lumbar veins. Lymph drainage of the abdomen mirrors the blood flow. The lumbar nodes drain the posterior abdominal wall, ovaries or testes, kidneys, adrenal glands, and ureters. The celiac nodes drain the foregut. The superior mesenteric nodes drain the midgut, and the inferior mesenteric nodes, which are not visible, drain the hindgut. All then drain into the cisternic hilate, which drains into the thoracic duct.